Pretty much all of us have heard about the benefits of daily supplements: calcium for our bones, vitamin C, an antioxidant, vitamin D, what's that, a cancer fighter? Well, you might want to hang on for a moment, because some U.S. scientists are now saying there is no good evidence that all of those pills and all those capsules are helping us. In fact, some nutritional supplements might actually be hurting us long term. CBC medical specialist Dr. Karl Kabasele joins me to help sort all of this out. The commentary, Karl, suggests many people might misunderstand the potential risks, really, of taking supplements. Can you break that down for us? Because I'm a little confused, to be honest.
Yeah, this is a tough one, because you're right. We hear about all these wonderful benefits of supplements and vitamins and so on. The problem is we're sort of getting the information piecemeal. Every time a new study comes out that vitamin D reduces your risk of cancer, it gets reported widely. Everybody rushes out and buys vitamin D. The problem is that when we come down to recommendations around cancer prevention, it really takes expert panels to review all of the evidence, weigh it up together, and then come out with recommendations. So we're kind of, what's happening is these pieces of research are doing an end around the experts and marketing directly to consumers, to the point where we as consumers don't have the tools to evaluate whether these things are good or bad. And that's why people often sort of joke that, well, this week I heard vitamin D is good, next week it's bad, what do I do?
Yeah, I usually say, you know, 2 red jelly beans versus 2 green jelly beans. Which one's better? One week it's red, one week it's green. Right. But folic acid, vitamin D, calcium, they were all included in this review. There are names that we are familiar with. Why do people take those anyway?
Well, okay, let's start with the antioxidants, like your vitamins A, C, and E, for example. The thought here is that because of oxidative stress on the body, we know that in some cases of cancer, that can sort of increase the risk of cancer or hasten the effects that lead to cancer. So the thinking here is, well, take an antioxidant and you stop the oxidative stress. Not necessarily true when you really look at the evidence and when you look at the higher quality studies. Now, a lot of the claims that are made are based on animal studies or test tube sort of laboratory studies, or what we call observational studies looking across the entire population, as opposed to what we call randomized controlled trials, where we say, okay, does vitamin C work? We'll give vitamin C to half of this group, we'll give a placebo to the other, and we'll see if there's actually a difference. And when you start doing higher quality studies, you find that antioxidants actually don't necessarily help with cancer. And surprisingly, they may interfere with your body's natural ability to fight off cancer with the immune system.
You know, that's what I want to talk about next, is under what circumstances dietary supplements can actually cause harm. That's one case where it can stop your natural body functions.
That's right. In the case of folic acid, we also know that there was great interest in it preventing colorectal cancer, and then the evidence comes out that it might actually increase the risk of prostate and breast cancer in some people. Now, I should say that, again, I'm kind of giving you piecemeal little bits of different studies, and it doesn't really pay for us to sort of focus on any one particular study. What we need, again, is a more organized approach, and sadly, we don't have enough information not only about possible benefits, but possible harms of a lot of these products.
Final question for you. So what do you do? You know, I mean, you listen to all of this stuff, you hear me say, hey, it's good, hey, it's bad.
Yeah.
I don't know. Do you know?
I don't know. That's the thing. I mean, I was going to say, talk to your doctor about it, but in a lot of cases, we as physicians don't know because the information's not there. Now, what we can say is if you have a nutritional deficiency, if there's a reason for you to take a supplement, then you should, talk it over with your doctor, figure out what it is you need. If you insist on taking supplements, I just brought a couple of examples, only to say that, and you won't see this because it's so tiny here on the label, but there's a thing called a natural product number, NPN, followed by a series of numbers. What that tells you is that Health Canada has at least looked at the product, considers it to be safe, and insofar as we know anything about the product, they're able to say that it's effective. So that may give you some measure of reassurance that the product isn't going to hurt you. But having said that, again, as different studies come out, we see that it's not, taking supplements or taking vitamins is not universally a good thing. We just don't know enough about what the effects are. So what I usually tell patients is if you have a reason to take a supplement, if you're iron deficient, you take iron, but there's no need necessarily to take these super doses of vitamin C, vitamin D, whatever it is, until we know more. And we definitely want to see more research so we can know more.
Excellent. Thank you, Karl.
Thank you.
CBC medical specialist Dr. Karl Kabasele.